Okay, perfect. All right. Hi. Thank you so much for joining me. For anyone watching right now, I'm Ellen with the Barton Associates marketing team, and I'm here with Dr. Lalani today, a locum tenens physician who is currently in New York City helping with the COVID-19 pandemic. So thank you so much for joining me, Dr. Lalani.
Thank you.
And to start off, how many locum tenens assignments are you on right now?
So I'm actually from New York City. I'm a native New Yorker.
Okay.
So I just finished one assignment and I am starting another one next week. So the one I finished was at a community hospital, and the next one I'm starting is at a pop-up hospital, which are these hospitals that are kind of built like tents, military style.
Right.
And we have several of those in New York City just to deal with the sheer volume of patients that we are seeing. And so that's my next assignment. So, most of us are moving from one assignment to another, or assignment with one need to an assignment of a higher need, depending on how much help is needed at the hospital.
Right. You're moving around. Right.
Mhm.
Okay. Are you able to paint the scene a little bit of what it's like to be a locum in New York City at this time, like what a typical day is like?
Yeah. So, New York City just has such a sheer high volume of patients right now. I mean, it's one of the most crowded cities in the world.
Right.
And so it's definitely been very hectic. um, Typically we're still having 12 to 13-hour days. Um, Hospitals are at maximum capacity right now. Most of the hospitals had to increase their capacity by 50% over what their regular capacity is. So that requires, more physicians to come in. Just because you increase the beds, you also need to increase the staffing.
Right.
At the time, our census has been a lot higher than usual. Typically, our census would be like 15 to 17, but most of us are seeing 20, 25. But we're managing. All of us are working like a team, and it's more of a teamwork mentality, and we're all just splitting up the patients. It's still 7 to 7 or sometimes 7 to 8, depending on when you're done with work, because these are all coronavirus patients now. Initially they were trickling in a couple of weeks ago, but most of our patients now are coronavirus patients. It takes a lot longer to see them because you are gowning in and out. You're changing your gloves and your gowns and your entire attire. So that takes longer to go from one COVID floor to go to another, or to go from a COVID floor to a non-COVID floor. So in itself, it's just very time consuming.
Sure.
Um,
Of course.
yeah.
Yeah, and what do you think the future holds in terms of day-to-day operations? Do you see any patterns or are you able to predict it all?
Yeah. So it's a little hard to predict right now. I would say that we are starting to see a plateau. Less and less patients are coming in, but now it's kind of hard to see things on the inpatient side because we're still caring for the patients that came in initially, because not all of them are getting well quickly or being discharged quickly. So a lot of it is trying to figure out a plan going forward, and that's why some of them are being transferred to other facilities like these pop-up hospitals to kind of create more room for more critically ill patients. So it's a little hard to predict right now. But we're hoping things do improve.
Sure. And I know that like locum tenens physicians can play a part in like the staffing surges,
Mhm.
whether it's more or less over the coming weeks, hopefully. Um, how does this compare to locum tenens assignments that you've been on before?
I mean, these assignments in general are just a lot higher census, and they're all coronavirus patients, which in itself is just so different than what we're used to seeing. Previous assignments when you're doing hospitals, you're seeing plethora of medical conditions, from heart disease to diabetes. But now, majority of patients coming in are all coronavirus patients because people are avoiding the hospital, if it's not necessary for them to be admitted. And so, in itself, it's just a lot more exhausting. And it's also scary, we're going into these rooms with coronavirus patients. Even though we're all gowned up, a little part of you is still scared. Um, and so there's also that factor that sometimes mentally takes a toll on you. But all of us are just, heading forward and staying positive and making sure that, we can all just get through this. So
Right.
itself
You
is
have to
just so
stay positive.
different dealing with coronavirus patients as opposed to just all the other assignments where you're just seeing, multiple medical problems.
Right. Stay positive to get through it. That makes sense.
Right.
And can you also talk about, it sounds like you're doing another locum assignment at the same time, actually, in Oregon. Could you talk a little bit about that?
Yeah, so I started my assignment in Oregon about over a year ago, and it's been on and off. So one of the great things about locums is that it lets you practice multiple specialties whatever time you would like. And so my specialty is palliative and hospice. And, my residency was in internal medicine. So I practice as a hospitalist, and I also practice as a palliative and hospice physician. So my assignment in Oregon is my palliative and hospice side of things, where I take care of home hospice patients. And so I usually do about a week or week and a half of hospitalist work, and then I combine that with my palliative and hospice job in Oregon.
Great.
So it's like 50-50.
Yeah. And how does that schedule work out? You're actually traveling to Oregon? It's not telehealth or anything?
Yeah, no, so I have been traveling. As of right now, I'm not traveling just because there's such a high need in New York City for physicians at this time. So I'm just staying home and going to all the hospitals from home that need the most help. But the one in Oregon, I travel to about 1 week a month or 5 days a month, usually, from New York City. And then when I'm on the West Coast, it's just easier to go anywhere else after if needed.
Great. Okay. So you've been doing that for a while, and you've kind of worked it into your locum tenens schedule, sort of.
Mm-hmm.
Okay.
Yeah, one of the most rewarding things about locums is that it really does give you the opportunity to practice different specialties in medicine the way you like. So I sometimes combine my month with a week of hospitalist, 5 days of palliative care, and then some preventative medicine work that I do in the city. So it's just a great way to combine my schedule and also enhance my skills and keep practicing different areas of medicine.
Yeah, no, I could definitely see that. Why did you originally choose to go into locums, specifically with Barton?
Yeah. So when I graduated fellowship, I wanted to take a year or two off just to travel internationally for fun and have some time to myself. I knew I didn't want to start, a full-time job right away. So I decided to try locum tenens just because I heard a lot about it. Some of my colleagues did it and told me great things about it. There's also, obviously all jobs have pros and cons, but after weighing it, I decided it's definitely something I wanted to try. So it gave me a lot of time to travel because I could create my own schedule with locums. I could do a week or 2 weeks together and then take 3 weeks off if needed, or do a month together and take another month off. And that allowed me a lot of flexibility. And once I started doing it, I just absolutely loved how I could combine all my different fields of medicine the way I wanted it. And then I just absolutely fell in love with it,
Right.
and on top of that, I just it gave me the opportunity to travel to different areas of the country. I got exposed to different health systems, seeing how things work, not just in one state, but in different states all over the country. And I also made some amazing friends that I'm still close friends with, and that are my closest colleagues. So, it just really worked for me and my schedule.
That's great. Yeah, I think we hear that from a lot of people. They're able to broaden their experience. They're able to travel,
Mhm.
not so much with a permanent, regular 9 to 5 job that people find themselves in, but with locums, they do kind of have that opportunity. So that's great. And how are you feeling about, kind of your current situation as a locum tenens physician, and about that decision during the COVID-19 crisis?
Yeah, one of the things that all of us, all the physicians and everyone in healthcare here has been talking about is seeing how incredible it's been that other locum doctors from other states all over the country have been coming to New York, coming to my city to help us in the front lines. And it's been incredible. Without their help, I don't think it would have been possible. So the fact that we have other doctors from all over the country coming in, knowing it's such a high stress situation in the front lines, but leaving their family behind and coming here to help us has just been so incredible. And it kind of just highlights the good side of being a locum doctor, that you have the power to go wherever you are needed the most in a very short notice. And so, being a locum doctor right now in New York City has been tough, but it's also been very rewarding that I can go from one place that needs me to another place that needs me more, like the pop-up hospital that I'm starting at next week. That's also a locum assignment. And I can be there and just give it my all, and help out 100%. So it's definitely been very rewarding.
That's great. Yeah. And I know that, all of us at Barton Associates really appreciate the work that you're doing. You and all of the other locum tenens providers right now that are doing their part to try and help in this crisis. So that said, thank you so much for talking with me today, Dr. Lalani.
Thank you.
I really appreciate it. And I hope you have a great rest of your day.
Thank you so much. Be safe.
Thank you. You too.